Every day we help people with various strains and pains. One of the most common complaints we see is back pain, especially lower back pain. It's difficult to diagnose why it's occurred. It's often better to deal with the symptoms. These can be dealt with by improving flexibility of the lower back and building the strength and support in the muscles around the pelvis and the lumbar spine. Flexibility is important. It improves the movement in the joints of the lower back, which in turn increases the mobility of the soft tissues, which helps to reduce pain. So I'm going to show you 3 easy exercises. This will involve you lying down, so make sure you're confident that you can get back up off the floor. Please don't get stuck. You can carry out these exercises on a bed if you can't get down to the floor, but they are best performed on a harder surface. So this exercise is a flexibility exercise. It's dead easy to do. The aim of it really is just a bit of a loosener to get your back moving. It's the gentlest of all the flexibility exercises that I'm showing. And what you need to do to start with is just lie on your back with your knees bent and your feet on the floor. Put your hands by your side wherever's comfortable, and then all you're going to do is keep your shoulders flat on the floor and roll your knees from side to side. This just creates a gentle rotation movement through the spine. Again, because you're lying down, there's no exceptional force going through the back. But again, to start with, I would stay just within where it feels comfortable. If you are in quite a lot of pain, it may be that to start with, you just roll your knees in that kind of amplitude. And then you can start to increase that amplitude as your spine starts to feel more supple. What I recommend is to do it 20 times or 10 times to each side. So this exercise is called the lumbar extension exercise. To start with, what you need to do is lie flat on your front. Take some deep breaths and try and allow the muscles in your lower back to relax as you breathe out. If this is quite comfortable and doesn't cause any increase in pain, try then resting up onto your forearms and elbows. Hold this position again while you take some deep breaths. Allow the muscles in your lower back to relax as you breathe out. Once again, if this position is comfortable, you can progress to the full lumbar extension exercise. Start again on your front with your hands by your head. The aim of this is to try and push up through your arms to straighten your elbows whilst keeping your hips on the bed, like so. And then back down to the starting position. This isn't a prolonged stretch, it's a mobility exercise. So once you have locked your elbows out, you don't need to hold the position. Come back to where you started. If at all you're struggling, some people do have naturally stiffer backs than others, and sometimes what can happen is the hips and pelvis will come off because of a lack of flexibility in the lower back. To increase the curve through your lower back whilst keeping the hips and pelvis on the floor, you can just edge your hands forward and push up and down again. It's important to make sure that the elbows get straight during the movement. Sometimes, as the stiffness eases as you do this exercise, you can start to creep your hands back again towards your head, so you get a bigger stretch on the lower back. I would advise that you do 10 of these. So this flexibility exercise is a stretch. It's called the lumbar rotation stretch, and it's designed to stretch you out through the lower part of your back. It's quite easy to perform, but if it causes you too much pain, then there's a different way of doing it, or I wouldn't do it at all if it's too sore. So to start with, lie on your back, straighten out your right leg, bend your left knee up, and then cross it over the right knee. Keeping your shoulders flat, what you're going to do is rotate your hips and knees over to the right, and you can assist this movement with your right hand pulling down on your left knee, like so. Once you feel this stretch in this lower part of the back, just take some deep breaths and count to 20. 2, 3, 19, 20. I'll show you that again just to make sure, and it's always good to do the other side as well. So again, keeping your shoulders flat, bend your right knee up this time, keeping your left leg straight, cross your right leg over your left knee, assist with your left hand on your right knee, pulling it over, and stretch to the other side. Again, it should be anywhere around here that you feel the stretch. Once you feel that stretch, count to 20. 1, 2, 3. I would try and do the lumbar rotation stretch twice to both sides. In terms of how often you should do the flexibility exercises, I would aim to do them in the morning and in the evening, but not first thing in the morning. Try and get up and move around a little bit first, get the blood flow going, improve your circulation, just allow the muscles and soft tissues to stretch out a little bit first. Then you'll get the most benefit from those exercises. For more information and advice on lower back pain, then look at my other videos on the Physio channel.